and welcome back to the drive home for a Monday. I need to make sure I get all these. Okay, I've got like 85 different buttons to push, and
it's full house.
It is.
Is it more than normal?
Well, I still had some other buttons opened over here, like the phone and the computer, and hopefully nothing plays.
Yeah,
we'll find out.
Text coming in, yes. That's fine.
Tanya Kenna, BD, in for your Monday edition of the Drive Home. But we've also got Christy and Nikki here from HSHS St. Anthony's Memorial Hospital.
Hey.
Hello, ladies.
Hi.
Hello.
Thanks for having us.
You are more than welcome. Now, we're going to be talking, I don't think we've talked about this before.
No, I don't believe we have.
No.
Not yet.
Okay, so we're going to talk about oncology today.
That's a big topic.
It is a big topic. And so what does a normal oncology rehab visit entail?
Well, this is going to depend. It's going to be person to person. It depends on the type of cancer and the type of symptoms they might be having and the specific type of cancer treatment that they have undergone. Typically, the first visit would be an evaluation. So we would assess things like for a breast cancer patient, range of motion, strength. We would talk about lymphedema if they were at risk for lymphedema, and kind of go from there. So, and then we would do different exercises like stretching, strengthening, depending on where they are at with their treatment.
Okay. All right. So, I guess what would they, do after that?
So you mean after the evaluation?
Yes, after the evaluation.
So the treatment itself, so at the evaluation, we give a few exercises, but the goal would be to create a home exercise program so that we are able to help them improve whatever area it is that their main goal is. Okay, so range of motion, if they have reduced range of motion, they're going to have a lot of tightness throughout the chest. We may do some manual work on them as well, so some light massage, but we're also going to give them stretches, give them a home exercise program so they can do that at home. So like raising your arms above your head, just for an example, like a simple exercise.
Right.
Some weights, we might use some weights, TheraBand, things like that for strengthening.
Okay.
If they do have lymphedema, we would also do our lymphedema treatment. We've spoken about lymphedema before.
Right.
So we would do complete decongestive therapy where we would take measurements of the limb that's affected, and we would also take measurements of the unaffected limb so we can compare.
Okay.
We take, like I said, the range of motion and the strength measurements so that we can kind of gauge where are we now, where do we want to be, and then hopefully at the end we've met our goal.
Okay. Now, what type of cancer diagnosis do you see most of when you have people come see you?
Well, typically we will see patients with breast cancer that have issues with that. We can treat patients with any cancer diagnosis if they're having limitations, weakness, deconditioning, those kinds of things. And we also see patients that have had cancer in the throat, head and neck, so we can treat those patients as well. And we work on whatever they have deficits in, range of motion, strength, swelling, any of those things.
You know, you were talking about some of the stretching and exercises there at the facility, but you were kind of saying, too, the ultimate goal is so that they can do some home treatments and things like that. Would most of that be like simple type of exercises and stretching, or things where they would need, to buy assistance like weights or a stationary bike or something like that? What kind of stuff is there for at home?
It's actually very simple exercises go a very long way. And I'm talking without weights sometimes, without TheraBand. We do have TheraBand to give to patients. That's just that stretchy band that has some resistance. Some patients already have weights. You can use a can of food for, I used to do a little home care, and you can use a canned goods for weights. The larger soup can will be heavier than, the smaller soup can, and you can kind of adjust from there. Some people want to go out and buy the weights, but you absolutely will not have to buy anything to continue your home exercise program.
Okay.
Yes.
Just go to your kitchen cabinets.
Yes. Yeah.
There you go.
That's not bad.
I know. So, how do people get in touch with you? I mean, do they automatically just give you a call, or do you normally get a doctor's order to come see you, or if they have questions?
So kind of the same thing for all of the other like lymphedema.
Right.
They would get a doctor's order. So they would just contact their doctor. They would write an order. Sometimes we get one automatically following any breast surgery. Radiation for head and neck is a big one that could cause lymphedema. So we'll get that order sometimes automatically. Mm-hmm. But yeah, they could just give us, get the order, and they could fax it to 217-347-1558. The doctor could. Mm-hmm. And if you have any questions for us, our phone number is 217-347-1243. And we are located at Richard E. Workman and Sports Complex for outpatient therapy.
You guys just mentioned breast cancer as one of the top ones that you are doing these type of treatments and things for. And that, correct me if I'm wrong, but does that also very rarely also affect men?
Yes, it does. It's not as common for it to affect men, of course, but we would do the same types of treatment with those patients, whether they're a man or a woman.
Okay.
Work on, check range of motion and see if they're having swelling, because you could have it in your arm or in the trunk as well. Mm-hmm. So we want to fully assess that, and sometimes that causes pain. Sometimes it doesn't, but you don't want to have that swelling hanging around there, so we want to help get rid of that and get them back to their normal function.
Okay, yeah, lots of reasons to get rid of swelling, it sounds like.
Yes.
Right.
Okay.
Well, one of the questions is, so lymphedema therapy ties into, oncology rehab.
Yes, absolutely. If I keep going back to breast cancer, I have additional education in breast cancer patients, and Christy here, she has additional education for head and neck lymphedema.
Okay.
So if a patient comes with breast cancer, they could be at risk for developing lymphedema. Not necessarily all of the time, but some cancer treatments can cause that, cause lymphedema.
Yeah.
Okay.
So like an axillary lymph node dissection, sometimes radiation, and certain types of chemo drugs. So typically, though, I feel like we would see patients following like an axillary lymph node dissection that are at risk for lymphedema. And even if they don't have it, we still take those measurements, because if they are at risk, we want to check back with them. So if they come back 3 years later and they're having issues, well, we're going to have those measurements now, and we could compare, and we could say, okay, this is where you were before.
Right.
So obviously this is going to be the goal for you now. So those measurements are good, and that ties into another topic I'd like to bring up is our prehab. Prehab is whenever the patient will go through therapy prior to cancer treatments.
Okay.
So this is to increase the strength that they have to get those baseline measurements, whether it's range of motion, strength, the circumferential measurement of the limb, like we just talked about for lymphedema. That way we can help them, whenever they do go through treatment, the cancer treatment, they're going to feel stronger, they're going to feel better, and their baseline is going to be higher. So then after we see them again, hopefully, we can just get them back up to that baseline where they were before a lot quicker.
Okay.
So that's the goal with prehab.
I have never thought of that, but that sounds like a great idea.
Yeah.
They do that for orthos too, like hip replacement, things like that. They do prehab to get them stronger before having surgery. Yes.
All right. Now, another question. Does St. Anthony's offer other services as part of the Oncology Wellness program? And what would those be?
Yes, they do.
Okay.
So the other services offered would be the nutritional services, palliative and hospice care, women's wellness, and that's going to include like the wig bank. That they're a great resource. And then, of course, like I mentioned, we have rehab and prehab, and that includes PT, OT, and speech, depending on the cancer diagnosis. And then we have additional resources as well, and we are constantly growing and adding services just based on what the needs of the community is. So.
Well, it's interesting. You guys, some of you have been here before, and we've had a lot of speakers talk about all the different departments and areas. It's interesting to see the interconnection between these. I mean, some are just for orthopedic injuries, but you have oncology issues, and there's a lot of crossover between some of the treatments and rehab, and now prehab even I'm learning about. Very interesting.
Yeah.
Yes.
There is a big crossover for sure.
I'm learning more and more. You guys coming in, each week. It's a very great learning tool, and hopefully, a lot of people are getting. I mean, they probably are thinking, "Wow, I didn't know you guys offered that."
Exactly.
Or, that's the big thing.
Yes, and with lymphedema, mentioning a crossover. I mean, we see orthopedic patients. We see patients from the wound healing center, oncology patients who just, have lymphedema, whether it's primary or just caused from for different reasons. So lymphedema is a big crossover.
Biggie. Yep.
Wow, that's
Gotcha.
Wonderful. Well, thank you, girls, for coming in.
Yeah,
Thank
no
you,
kidding.
Christy. Thank you, Nikki, taking time out of your day to talk with us and informing a lot of our listeners about the programs that you guys have at HSHS St. Anthony's.
Yes, thank you so much again for having us, and happy birthday.
Thank you. Thank you very much.
Birthday wishes continue. Birthday wishes continue.